Assalamualaikum, we are from group S17, table 2, and here are our group members. So, I am Muhammad Iqbal Aziz bin Shamsani, and here is...
My name is Muhammad Akib bin Adi Bahtiar.
Hi, my name is Muhammad Danish Hakim Bibi Rosli from S17.
Hai, Assalamualaikum. My name is Muhammad Danish Imran.
Nama saya Muhammad Faris Putra bin Omar dari S17.
Welcome to this presentation aimed at raising awareness about pneumonia in Malaysia. We will explore its recent data, its history in our country, its symptoms, causes, treatments and preventive measures. For recent data, it shows that the number of deaths in 2023 decreases by 4.7% from 206,000 people in 2022 to 196,000 people in 2023. Pneumonia continues to be a significant health concerns among people in Malaysia, especially for elderly and those with chronic health conditions. Globally, pneumonia affects approximately 450 million people annually, and that is resulting in about 4 million deaths.
Now let's take a look at the chronology of pneumonia in Malaysia. Pneumonia has been a persistent health challenge for decades with seasonal spikes, especially during rainy seasons where respiratory infections become more common. In addition, the COVID-19 pandemic between 2020 and 2022 has impacted pneumonia trends in Malaysia. Many severe COVID-19 cases led to viral pneumonia, contributing to an increase in respiratory-related hospitalizations and deaths.
Iqbal, are you okay?
No, I've actually been coughing a lot lately.
Does your cough produce mucus?
Yes, it actually does.
Oh, did you experience any other symptoms?
Actually, I've had a fever for a couple of days now.
I see. I think those two are the symptoms of pneumonia.
Oh.
Okay, so actually there are a lot of other symptoms. So the other symptom of pneumonia is low energy and also muscle fatigue, vomiting and diarrhea, chest pain when you breathe and cough, and also headache. In addition, there are also confusion also occurs in the older group of people.
So, now that we know about the symptoms of pneumonia, let's talk about the causes of pneumonia. So, pneumonia can be caused by in 4 different ways, which is firstly, bacterial pneumonia, second, viral pneumonia, fungal pneumonia, and last but not least, aspiration pneumonia. Okay, so bacterial pneumonia is when pneumonia is caused by a bacteria called Streptococcus pneumoniae. It will infect the lung and cause pneumonia. Then we have viral pneumonia. So viral pneumonia is when pneumonia is caused by respiratory viruses such as influenza, coronavirus, and RSV, which stands for respiratory syncytial viruses. Then moving on, pneumonia can also be caused through fungal infection. So some of the common types of fungi that can infect the lung is Cryptococcus and also Aspergillus. And usually the fungal infection is more often common in people with weakened immune systems. And last but not least is aspiration pneumonia. So it causes pneumonia when food, drinks, or even vomit and saliva is inhaled into our lungs, therefore causing infection and pneumonia. So, what are the actual ways to treat this disease? So firstly, if it is a bacterial pneumonia, we can treat the disease using antibiotics. This is because antibiotics can help kill the bacteria which causes the infection on the lungs. Though it is a different case if it is viral pneumonia. This is because the antibiotics is ineffective in killing the viruses that causes the infection. Therefore, we primarily treat this disease through supportive care. Though in some cases where the virus that causes the infection is known, we are able to use antiviral medicine which is prescribed from doctors.
To continue from what has been said earlier, supportive care is one of the treatment for this disease. So the example of supportive care is an adequate amount of sleep are essential for our body to fight off this infection. Besides that, staying well hydrated also could help removing the mucus in our lungs. Next, there are also pain and fever relief such as ibuprofen and also acetaminophen that could reduce and relieve any pain. But in severe cases, hospitalization is required, especially for high-risk individual, so that the treatments such as oxygen therapy and also breathing treatments can be done.
So now, let's move to the point of precautions and preventive measures. First of all, we can take up vaccination, specifically smoker vaccines, to prevent the getting infected by pneumonia disease. Also, animal influenza and COVID-19 vaccines can also reduce the risk of getting viral pneumonia. Second, we can take care of elderly and vulnerable individuals by ensuring they get a regular medical check-up for those people with weakened immune system. And then those with chronic lung condition can consider pulmonary rehabilitation.
Good hygiene plays a key role in preventing pneumonia. Simple actions such as always washing your hands with soap and water, especially after coughing, sneezing, or being in public spaces, help reduce the spread, help reduce getting pneumonia. It's also important to not touching your face with unwashed hands, and always cover your mouth and nose when sneezing or coughing, especially in public spaces, to prevent spreading germs to others. Other than that, maintaining healthy lifestyle choices is another key to prevent pneumonia. Avoid smoking as it weakens your lung and makes you more prone to infection. Focus on building a strong immune system through balanced diet, regular exercise, getting enough sleep, and always managing your stress. By getting our body healthy, we can reduce the risk of getting pneumonia and makes our body to able to recover quickly if we ever get sick.
So, in conclusion, pneumonia remains a significant health issue in Malaysia, affecting all individuals across all age groups. The awareness of its symptoms, causes, treatment, and preventive measures is very crucial to reduce the impact of this disease. So let's commit to a healthy lifestyle and prevent pneumonia disease.